All right, welcome back in. It happens to all types of people, but around this time of year, we hear about a lot of ACL injuries with football players, of course. Dr. Michael Patterson is a physician at Precision Sports Medicine and Orthopedics in Alabaster. Thanks for joining us, Doc. How you doing?
Doing great. Thanks for having me.
All right, so tell us, what is the ACL and how can it get injured, really?
So the ACL is a ligament in the center part of your knee, and it connects your femur or your thigh bone to your tibia or your shin bone, and it provides stability so your leg doesn't shift out in front of you. It also helps with the rotatory or rotational control when you try to make a pivot.
Yeah, well,
and that's
no, keep going. Yeah, sorry about that. I didn't mean to interrupt you there. And why are there so many ACL injuries?
Well, I think we see it more commonly now for a number of reasons. Number one, there's a lot more people participating in sport at all different ages. I also think the use of MRI has become more widespread, so we don't miss ACLs. And then clinically, I think we've gotten better at diagnosing those.
Yeah. What exactly are the treatments for it? I know that we hear a lot about the surgeries or the orthopedic type surgeries that get these athletes back on the field so quickly.
Sure. So most ACLs, and they mostly occur in younger and active people. And so if they want to return to those type of cutting and pivoting type activities, then the ACL is very important. So generally, for those patients, we do recommend ACL reconstruction. Certainly in some of our older athletes, that may not do a lot of demand on their knee, you can sometimes rehab those and put them in a brace, and for the most part, they can remain relatively functionable, certainly from a walking and jogging type aspect.
Yeah, and I've got to take it into my account. I'm over 50, and it's important that I enjoy the latter part of my years and be able to do things. Is that not correct?
That's correct. And I think, even in those patients, it really depends on how symptomatic they are from that ACL deficiency. Some people have a lot of trouble with it. Every time they go to twist or turn, their knee wants to give out or buckle on them. Then obviously that's an indication at that point to go ahead and fix that ACL and stabilize that knee and get them back to their active lifestyle.
Well, with athletes, what can they do to maybe prevent these injuries? Is there anything that can be done for them?
So a lot of times, preoperatively or even just preventatively, you can get in some programs, and a lot of therapy practices now have programs that are designed to prevent ACL injuries. And you'll see a lot of younger kids that have some weak muscles, either in their quads or hamstrings, or those people that kind of jump and land awkwardly. Mm-hmm. You can really work on those and correct some of that and hopefully prevent those injuries from occurring.
And what about for some of us older folks? What can we do to prevent it, really?
I think the same type thing, certainly being on some type of strengthening program. Mm-hmm. So as we tend to age, we lose muscle mass. So kind of trying to maintain that muscle mass in our legs, in our core, those things are all important. Certainly stretching before you do any activity so you don't put a lot of strain over your joints.
Hey, we certainly do appreciate you joining us in, Dr. Michael Patterson. Thank you so much for being with us today, okay?
Thank you for having me.
All right, really nice job there.